Hello everyone, I'm Dr. Vivek Venkatramani, consultant uro-oncologist and robotic surgeon in Mumbai. Today I'll be telling you a few things that may be essential in order to maintain good kidney health. The first is adequate hydration. Dehydration always produces some stress on the kidneys because they have to concentrate the urine much more than usual. Maintaining adequate hydration also reduces the risk of formation of kidney stones. However, in patients who have cardiac issues and in whom the heart is not pumping properly, they may have been prescribed certain fluid restriction by their cardiologist. So always check if you have these issues as well. The second important thing to maintain kidney health is a good diet. And what do I mean by this? The first is a reduction in salt intake. Try to avoid adding excess salt to any food that you may be eating. The use of ultra-processed foods are also high in sodium, phosphate and other electrolytes which may produce a load on the kidney. So try to avoid these particular foods. Generally, anything healthy for your heart is also healthy for your kidney. Therefore, a diet with low salt, restriction of sugars, restriction of cholesterol or saturated fats, and a diet rich in green leafy vegetables is also healthy for the kidney. One important component of kidney health is also to avoid an excess protein intake, especially in the form of red meat, as that also produces an excess load on the kidney and requires much more reabsorption from the kidney. Especially in those who already have a borderline kidney function, it is important to avoid excess protein intake. In patients who are already suffering from certain illnesses like diabetes and blood pressure, which can potentially impact their kidney function, it is essential that they monitor these diseases carefully. Close monitoring and regular checkup of the blood pressure is important because over time the kidney can get damaged if the blood pressure remains high persistently. Similarly, India is the diabetes capital of the world and a lot of our patients are diabetic. It is very important to maintain your blood sugars in the normal range so as to protect the kidneys in the long term. Any exercise for up to 30 to 45 minutes per day will help both the sugars, the blood pressure, and if it helps to reduce your weight, will also help to reduce the load on the kidneys and allow them to maintain their function for a long time to come. Another important factor that may potentially impact kidney function is the use of certain medications. Medications have to be metabolized and excreted by the kidney, and therefore the kidneys are very susceptible to certain toxic medications. Excessive use and abuse of certain painkillers, especially non-steroidal anti-inflammatory drugs, can definitely affect kidney function if taken for a long time. Certain other supplements, especially used in bodybuilding, may also affect the kidney function. And of course, smoking and alcohol are toxic to the kidney just like they are toxic to every other cell in the body. Finally, all people who are above the age of 50 or 55 should get a regular checkup to ensure that their kidneys are working adequately. This usually involves a simple blood pressure measurement, checking the blood sugar levels, ensuring they are not diabetic, checking the urine routine to look for any protein or blood, as well as the renal function, which involves the creatinine and blood urea levels. These are generally a part of any routine package which is done for an annual health checkup. It's always better to be safe than sorry, so keep your regular checkups on time, and if there is any doubt, you may visit a nephrologist in order to optimize certain medications or diet that will help you maintain the kidney function in the best way possible for the long term. If you found this video informative, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.